good afternoon, good morning, depending on where you are. This is Brian Corbin. I'm the Executive Vice President of Catholic Charities USA, and I want to welcome you to our event this afternoon. This is now being recorded, and I'm so glad that you were able to join us. If you've been around Catholic Social Ministry gatherings before, welcome back. If this is your first time, welcome aboard. This is my 33rd consecutive Catholic Social Ministry gathering, so I'm thrilled to be here. And today, Anthony Granado, our Vice President for Government Affairs and Social Policy, and Kim Mazyck, who is our executive leader in community outreach and education and advocacy. We're going to be presenting to you a brief, but we hope punch-filled information about the work of Catholic Charities around the country. So Jessica, if you could go to the next slide, I'd appreciate it for one moment. So we're going to talk a little bit about Catholic Charities USA and our mission, a little bit of our COVID response, since as you can imagine, this has been very important for us. We're going to go to some of our services to just highlight some areas around the country and look at some of our social policy priorities and tools. And then hopefully by using the chat function, if you have any questions, please feel free to type us in a question and we'll try to get back to you either during this process or after the event. We'll get to you, and you can always come visit us in our exhibit hall. And we'd love to talk to you some more. The next slide, please. So Catholic Charities, as many of you know, are all over the United States, and it's very much rooted in the gospel message of Matthew 25, specifically, when I was hungry, thirsty, a stranger, ill, in a visitor, you helped me. And we have this icon that we've been reflecting on for the past several years in the Catholic Charities ministry of the Good Samaritan. And again, paralleling the issue of a person stopping and doing good work, and then the innkeeper, the institution that continues that work and provides ways of helping people and communities in their struggling, especially those who have been kicked aside or displaced or vulnerable and marginalized. We constantly are concerned about that road between Jerusalem and Jericho. How do we help people who may be hurt or beat up along that road? But how can we make that road safer? So Catholic Charities continues to look at services, at advocacy, and convening in order to help build justice as well as serve people's needs immediately. So we're rooted in the gospel, and we're here to proclaim that good news that Jesus is here to love you and cares for you, and we're his hands, his feet, his body, the institution of the church, here to help you. And that's what our very rootedness is. The next slide, please. So just a very quick overview of how Catholic Charities is organized. So Catholic Charities USA is the national headquarters. We have 167 diocesan member agencies in every single state and the 5 territories of the United States. So as Catholic Relief Services is the international arm of the bishop's ministry, Catholic Charities is the local ministry of the bishop in terms of helping people in their needs. So as you can see, we served last year together, 13 million persons were served. We have a total about 41,000 employees of all the Catholic Charities agencies around the country. We have well over 250,000 volunteers, from people in the direct services, helping at a food bank to our board of directors. So we have a lot of volunteers that we kind of leverage all that. And you can see from our basically income and expenditures together, aggregately, all the diocesan Catholic Charities institutions basically have a $4.9 billion ministry that we engage people and help people from housing, you'll see, to disaster, to health, to immigration. So we'll talk about that in a couple minutes as well. The next slide, please. Over the past couple of years, Catholic Charities USA and its member agencies have talked about what are some priorities that we need to do in order to have more laser beam focus and really get to the issues that are really impacting most of our communities. And we've come up with 7 areas that we've said that we really need to focus on. One is affordable housing, another is integrated health and nutrition, immigration and refugee services. And as you saw from the executive orders this past week, this is going to be a major reissuing of what we do. We also talked about how we have to develop leaders and have to strengthen and deepen our Catholic identity as institutions of the church, and how we bring that ministry of the church to both the church itself and to the community. Also, disaster services. So continuing to look at how to respond from that tornado in a small community to hurricanes to COVID response. So looking at how we can help people in disaster. Also looking at social enterprise development. How can we help in workforce development and employment of some of the people that are most needing of work, and how can we help build new ways of doing work. And finally, but not unimportantly, our advocacy and social policy initiatives. We're going to hear more from Anthony and Kimberly in a couple moments on how we do that. Next slide, please, Jessica. Just want to give a quick update to all of you about COVID. So obviously this very meeting is because of COVID, the way we're doing it. And for this past year now, Catholic Charities around the country, in every locality, basically we did not shut down. The church did not close. We continued to do the work of the ministry of Jesus in the ways we had to. Many of us had to pivot. And we found out for the past, not 10 months, we have been spending, Catholic Charities collectively, about $100 million a month just in COVID-related ministries. So we've had to pivot most of our work. We've had to look at new ways of doing, especially food and basic needs assistance. And so our institutions have found incredible ways, and our donors have been very supportive of us. And we have been very blessed to be able to go there in the front line literally to distributing monies from foundations, to donations of food, to personal protective equipment, doing outreach for health-related efforts. It's a constant effort, and we're continuing to be there. Just recently, the Felician sisters, who lost several of their community members to COVID, called us and said, how can we work with you in Catholic Charities? And Sister Donna Markham, our president and CEO, basically a Dominican, Adrian Dominican, also shared that some of her members of our community have passed from COVID, and her community members have been impacted. So together, Catholic Charities USA and the Felician sisters created an eviction prevention fund in order to prepare ourselves with private monies to engage in the entire work, what's happening right now to prevent homelessness. So hopefully you'll see more of that that's going on, but I just wanted to give you all an update on that. And also, I just wanted to give a little shout out to many of our agencies that have been working very specifically with the United States Department of Agriculture, called their Farmers to Families program, connecting farmers with people who need food. And many of our Catholic Charities agencies, our brokers, are able to kind of bring together those farmers and those people that need help. So we're honored to be part of that ministry as well. So that's just a quick update of our mission, our rootedness, our strategic priorities, and a little bit of what we're doing in COVID relief right now. So I'd like to switch it over now to Anthony Granado and to Kim to give us a little bit more information about how our work in services bring us to a point of social policy and advocacy and convening. Anthony, Kim?
Thank you, Brian. Appreciate that. Next slide, please. So as Brian mentioned, my name is Anthony Granado. I'm the Vice President of Government Relations for Catholic Charities USA. So I lead the social policy team, managing the legislative and regulatory affairs for Catholic Charities USA. But in service to the 167 member agencies of Catholic Charities around the country, but most importantly, to the very vulnerable people, our brothers and sisters in need who come to the doors of Catholic Charities every day. My team, as you can imagine, has been working diligently on the issue of COVID relief and legislation related to COVID relief. Kim Mazyck on my team will be joining me today to kind of go over some of our policy areas and what we've been doing. Since the beginning of the pandemic, COVID has been front and center in our work, whether looking at the regulatory side of things or legislation. So we've seen several bills pass to advance stimulus money on COVID relief. As you can imagine, one of the lenses, and Kim will talk a little more about this later, we've been looking at in COVID and the pandemic is the disparate impact on low income and people of color, African Americans, Latinos, frontline workers, people in meatpacking businesses. And so issues related to immigration, testing and vaccine availability, funding for state and local dollars. These are the bread and butter of Catholic Charities agencies and reaching out to people in need. I cannot underestimate the level of impact that the housing crisis is having and unemployment. And so that is something we've been consistently pushing, is to address the eviction moratorium to ensure, at least for the time being, that people are not left out. So COVID legislation will continue to be a priority of ours. We worked with the Trump administration on this and are now working with the Biden administration and hope for a new COVID package. So next slide, please. Kim.
So and hello to everyone, good afternoon. In order to successfully address our priorities that Brian outlined earlier, it's really important that we also address and examine the impact of racism, especially systemic racism, not just in our programs, but especially in our leadership development and our Catholic identity, and even how we evaluate our advocacy policy. We updated a document that was produced in 2008, but we looked at this document again last year in 2020, and you'll see the link here. It's also available at our exhibit booth. But really, how do we do this work as we work to make sure that we're agents of racial justice? Next slide.
Housing, as I mentioned, is going to be a key priority of ours. The eviction crisis that has come from the pandemic really puts a lot of people in jeopardy around the country to become homeless. Last year, we served 13,900 people with seniors with housing. Right now, outside of the federal government, Catholic Charities and its agencies are some of the largest producers of affordable housing in the country. This will be a signature issue for us, whether you're talking about transitional living or emergency shelter or funding in the appropriations legislation for senior housing. This is the 202. So please stay tuned, because as you know so well in your communities, housing will be a very key issue. Next slide. Part of our outreach is the Healthy Housing Initiative. This is a program initiative of Catholic Charities in collaboration with Catholic Healthcare and others. And that is to find properties in common that we can work together in a joint effort to promote affordable housing for people and communities. So the Healthy Housing Initiative of Catholic Charities USA has identified 5 pilots in East Detroit, Las Vegas, Portland, St. Louis, and Spokane. And the goal is to find these properties and to develop housing to serve people in need and help to reduce chronic homelessness by 20%. And this is about joining the health concerns that impact low-income people, as well as the housing concerns that impact low-income people. You know, for human flourishing, these things go so close together that it makes sense for us to roll out this program to address many of these concerns of health and housing. Next slide.
So of course, as we talk about the impact of the pandemic, we look at food and nutrition. And I hope when you see these numbers, about 9.4 million people fed, you understand the impact that that has. And so these numbers really talk about what we've done in the past year. But we really are now focusing on what has looked at in terms of the pandemic. Next slide. So what we've realized is that after we looked at numbers, and this was towards the end of last year, and so these numbers are continuing to increase, that more than 15 million people, which includes about 17 million children, are experiencing food insecurity. And so one of the important things that we were doing in our advocacy work is how do we enable people to get not only acquire food, but get it safely. Brian mentioned the Farmer to Families program. That was a federal program that we were a part of, and a lot of our agencies participated in getting food directly from farmers to families. But the other thing is we were really working to make sure that we had additional emergency allotments. So we advocated for that. So states had more power to supplement SNAP households that were receiving SNAP so they could receive more than their maximum benefit. Also, online purchasing, which had not been an element of SNAP before, was an element during the pandemic. And we're hoping that's something that can continue. For a number of our families that we know that we serve and work with that are doing shift work, this is an opportunity for them to enable them to acquire food and still be with their families and still not have to take that time, potentially going a distance somewhere, but also being able to stay at home, especially if there's somebody who has comorbidities in their house, to really alleviate their contact with people who might have COVID-19. And also another waiver that we thought was extremely important during this time is allowing parents and guardians to pick up meals for children without the children present. That's always been another element, and that means a parent may have to leave work, go home, get their child, and then go back to a place. And they may have passed that place to pick up the food for their child ahead of time. So we see these are just some waivers that we saw in the last year that we really thought made an effort to enable families to pick up and access food a little bit more safely. Next slide.
When clients come to Catholic Charities programs throughout the country, they come with many disparate needs. You cannot silo certain needs off from another. This really speaks to our church's understanding about the importance of human flourishing. So the COVID pandemic, of course, has raised issues about not only healthcare, access to vaccines, nutrition, but we're also seeing increase, unfortunately, in opioid abuse, suicides, behavioral health problems. We need to talk about the access to certain healthcare like Medicaid expansion, substance abuse. So this really speaks to our integrated health model by which a client could come to a Catholic Charities and visit with a caseworker and find that the client may need help with housing, they may need help with nutrition assistance. And so this really, at the end of the day, is about the integrated nature of the work of Catholic Charities to promote human flourish. Next slide.
So when we talk about serving our elders in our community, of course, that's a huge concern of ours. That's work that we have been doing, and you see listed here some of the things that we have already been doing across the country in terms of adult daycare, continuum guardianship, chore services and home repair, and even the senior corps. What we've also seen during this time of COVID, especially our seniors, are not, because we know that they are at a higher risk. So we want to make sure that they are able to be taken care of safely. And so during the pandemic, we've had a number of vital services, but the two that I want to highlight for everyone, because I think they'll resonate with you, is telehealth counseling. We've seen a lot of loneliness with our seniors that are alone. And so this is an opportunity for them to connect even online, which is what we're doing here today. And then home delivered meals. I spoke with the person who's our point person for seniors on staff, and I was apprised of this, that Catholic Charities Vegas has been delivering more than 72,000 meals each month to seniors. So there's been such great work happening, and I know that puts a lot of people at ease, knowing that there's only so much we can do safely to work with our seniors in our community. Next slide.
The history of Catholic Charities, centered to that is the service to children in need. From its very beginning, Catholic Charities agencies were serving orphans and women in crisis pregnancy. It's intrinsic to our pro-life values and the desire and the need to care for vulnerable people. Adoption and pregnancy support is very central to the mission today of many Catholic Charities agencies. I myself am an adoptive father of 3 children from Poland, and it was Catholic Charities of the Diocese of Arlington that helped my wife and I with our home study and placement with our children. And so it's not only about providing services to children in need, but also to ensure that these children have loving homes, long time, forever homes, and also to serve the women who are in crisis pregnancy. I think we cannot forget that counseling and other assistance is important to, if we're really going to be pro-life, to serve those women in need. Next slide, please. So immigrant and refugee services is central. We work closely with the United States Conference of Catholic Bishops, who has a relationship with the State Department on the refugee program, but it's at Catholic Charities in the local communities where refugees find a home and they are resettled in local communities. The president, through an executive order, has indicated he is going to be looking at the refugee numbers again. We anticipate going back to more normal levels for refugee resettlement. The president has suggested upwards to 125,000, down from where under President Trump, it went to historic lows of 15,000. So we are hopeful on that, and we're hopeful we'll see more refugees settle in the United States. Secondly, as you've been watching the news, there is a large influx of persons coming from Central America northward. And so many of the Catholic Charities agencies on the US-Mexican border are preparing for that arrival. And our message is that we will arrive, that when these people arrive, we will not only work for their legal cases, their asylee cases, but we'll provide the direct services that they need. And we are asking the Biden administration to help with this, and that we will work in collaboration as these persons arrive to the US-Mexican border. Next slide. Again, this is just kind of some of the information of some of the things that we look at in immigrant and refugee policy. Comprehensive immigration reform remains a priority of ours. Family separation, of course, Sister Norma Pimentel and others at the US-Mexican border, San Antonio, Texas to San Diego. These charities agencies are responding directly in need, particularly those who have been left on the Mexican side because of the Biden or the Trump administration remain in Mexico policy, which of course is going away, but there will be a lot of pieces to pick up in the wake of that policy. Next slide. Disaster response is another area of the key work of Catholic Charities, and we work quite in partnership with FEMA, whether you're talking about tornadoes, hurricanes, earthquakes, fires. Catholic Charities USA rolls out volunteers and staff to assist in these areas. Of course, with the fires in California, the earthquakes in Puerto Rico, their effects of hurricanes in the Gulf states, Catholic Charities agencies are on the ground working with FEMA and others to care and respond to people in need. It's a central priority of ours at Catholic Charities. Next slide.
Sorry. In terms of workforce development and training, job training, we've talked a lot about unemployment, especially during the time of the pandemic. The social enterprise section of Catholic Charities is one of our most innovative ways to provide workforce development and job training, especially when we talk about unemployment and underemployment. So this is an opportunity for us to train and employ our agency clients. It's a way for us to facilitate social change, which I think is the most amazing piece of this. And we also strengthen most local economies. The reason I think this is so important is that we're talking about moving people from a low-income community, a low-income situation, to the ability to be completely independent and to be fully participatory in society. So, and I'm not just talking economically, I'm talking about socially. When somebody is employed at an adequate level, it really changes their outlook. I would encourage you to visit our exhibit booth to learn more about this social enterprise work that we're doing. And our colleague, Steve Bogus, is attending the conference, so he's around if you'd like to talk to him about this work. The next slide, yes. So as Brian mentioned earlier, when he talked about the story of the gospel story of the Good Samaritan, our Catholic identity is central to who we are, and it's central to how we develop leaders. So we're constantly not only just doing all this amazing programming that is still rooted in the gospel, but really thinking about how we shape and form who our leaders are and how we work with each other. So we offer a number of trainings, and also for those of you who are on our list, you can receive reflections during the Advent season, during the Lenten season, and during the Easter season. So a large part of the year, except for ordinary time, I guess you would say. But we realize that it's really important that we do this to develop our network so that we're all very much rooted when we do our programming, that it still comes from this core of our values. Next slide, please. And also, a number of you are probably belong to your local parish and thinking, how can I get involved? And I would encourage you to seek out the Parish Social Ministry Program. As much as we talk about this programming happening at an agency level, a lot of this work is also happening at the parish level. And there's ways for you to be involved. I'm sure some of you know of a pantry that is run by your parish. And so that's often in conjunction with the local Catholic Charities agency. But case management, disaster response, when all of these shocks to our communities happen, a lot of people go to their parishes, and that's where they are able to begin the initial accessing of services. So parish social ministry is important. We have a section. We have some amazing leaders that serve as part of our parish social ministry leadership team, and we're constantly trying to figure out better ways to support our leaders in the parish life. And that includes those of you who are on this session with us today. Next slide.
A key part of our mission, as has been brought up here, is the Catholic identity. It should be remembered that we do not serve people because they're Catholic. We serve people because we're Catholic. And that's a key message we bring to the administration and Congress. One of the things we ask for is the freedom and the ability to serve and according to our traditions and values. And so that's something that I think is central to our Catholic identity. On budget and appropriations, I'll just basically say this. We look at the budget documents and what Congress does and how it appropriates funds. These are moral actions, and they're moral actions because they're decisions about who is going to benefit from federal dollars. For the Catholic Church, as you can imagine, and the work of Catholic Charities USA, we take very seriously the Church's social teaching about solidarity and preferential option for the poor. So stay tuned as you will see right now, for example, a budget reconciliation debate is going on in Congress, and that will be very key to what happens next with COVID stimulus funding. Next slide.
So as we mentioned earlier, Anthony and I are part of the social policy team at Catholic Charities USA. And so we have a lot of tools and resources that we want you to access and we'll make available to you. A newsletter that we send out weekly called the Washington Weekly gives you a legislative update, often an update on what the presidential administration is doing well, and also ways for you to engage. We also, again, we talked about Catholic identity. We always have a faith in the common good section to really relate what's happening in the world or where we're at, just to give a prayerful thought to what's going on in the world at this time. So you can sign up for all of those things in our exhibit booth, and we encourage you to do that. but we're also available to provide legislative training. We've done webinars. We constantly do them on our policy priorities, and we facilitate. Now we'll do it online, but we had facilitated people coming into town and going to visit their members of Congress that represent them both in the House and Senate side. And we've still been doing that throughout 2020. We've been doing that on Zoom calls just like we're on now. And what we have found is that our members of Congress are willing to meet with us that way, either them or their staff. So we encourage you not to think that advocacy can't happen. The same way it's going to happen Tuesday at this gathering is the same that we're doing it. And we encourage you to bring those issues to bear, and we'll work with you and your agencies to make sure that we're representing your voices and your experience in your community. Next slide.
And so I just want to share, this is the social policy team at Catholic Charities USA. I'm very proud to work with these persons. They bring many years of experience and keen knowledge on everything from nutrition assistance to housing, to immigration and refugees, to budget and appropriations. So we're always at service to the Catholic Charities and Network, or if you have any questions for us, we're always available to assist. And we work very keenly with many of our partners, closely with the USCCB, Catholic Relief Services, and others. So I'm very proud and blessed to be a part of this team. So I think at this point, Ryan, I think we're going to open it up for questions.
Yes, thank you. Thanks, Kim and Anthony. And there's been questions going in the chat box, some private, some public, and I've also responded to several people in the private level. And again, please, since our time is running short, please use my email address and send me any comments or questions, and I'll get them to the right person. But one question, I guess I'll give you two questions. One is, when do you think the border issue might be opening up, or how do you perceive what's going on there? And if you were going to meet with a congressional person tomorrow, what's the highest, what would be a talking point from Catholic Charities we'd like to get to a congressional leader?
Well, to the first question, I would say the people who've left the Central American countries are on their way now. We've been in discussion with the Biden administration and others in Congress, and there's been a lot of discussion about when they're going to arrive and what the process will be. So we're trying to get a hold of that. Our message is basically that we're there. The border agencies, again, from San Diego to the Rio Grande Valley, are available and have the necessary staff and resources, but we can't do it alone. We need to partner with the public sector and the private sector to respond to these persons who will come with many great needs. I don't know, Kim, do you have a thought about the second question?
Sorry, I'll be honest, I was answering 3 or 4 questions that came directly on the chat. So if you could repeat it, I'm sorry, go ahead.
So what would be some things that if you were going to meet with a congressional leader tomorrow, what would be one message or so from Catholic Charities perspective that we'd like to get out?
Well, I mean, I think, I'm like I said, I'm sorry, I was distracted. I had like 10 messages that came to me directly, but it just remind people, especially those of you who are in parish life, I always think it's important to use examples from your own community. So if you know what's happening, even if you haven't been able, let's say you used to work in the pantry, but you're not there now, but you know what the need is in your community, I would impress upon them to know that people have needs and they need to be addressed, and that we will continue to do the work we're doing, but it's such a vast responsibility for all of us that we can't do it alone, and we really need the federal government to be part of that effort to serve our brothers and sisters across our country.
Thank you. And in the next minute, just to wrap up, I want to thank everyone again, and please send me an email. I will get it to the right person on our staff. But quite honestly, we are so thrilled to work with USCCB, Domestic Policy Office, the MRS office, to name a few, the Pro-Life Office, the Youth and Family Ministry Office, as well as CRS and Clinic, and many other institutions. So we try the best we can here in the nation's capital to make sure that all of us are in conversation and continue to push the entire message of the Church of justice and peace and life. So we thank you all for all the work you do at home, and thank you for all the support you give us. And please feel free to call your local Catholic Charities agency and find a way that you can be part of it. So with that being said, I want to thank you all, and I know we have to leave because the next session will begin, I believe, in 15 minutes at Eastern Time, 3:30. So I hope you all have a great day, and thank you so much.
Thank you all.